So our next speaker doesn't really need much of an introduction, and actually I'm quite humbled by his biography he's given, since it's very small considering the amount of work that we know that Dr. Rivard has done in his career. So as I'm about to introduce Dr. Georges Rivard, he's a clinical professor in the Department of Pediatrics at the University of Montreal. He's a hematologist-oncologist at Sainte-Justine Hospital in Montreal, the medical director of the Coagulation Laboratory at Sainte-Justine. He's the co-director of the Hemophilia Treatment Center and the co-director of the Quebec Reference Center for Coagulation Inhibitors. And I've also been told that he was also the recipient of the Dr. Victor Blanchette Award yesterday at the CPTHN meeting. So, Dr. Rivard, please come up.
Thank you, Vanessa. Well, I'm standing up here as a stead for Jean Saint-Louis and Claude Meyer, as stead for many others. So for this reason, I will be using the editorial we. I learned something this morning. I always learn something when Jerry Title talks, so I will be using the editorial we, or for my French-speaking colleagues, I will use the le nous papal. That means the we from the Pope. So this sounds a bit pretentious, but happens to be the way it is. But I have to say that the we papal here will not include the me. That being said, of course, I am very much interested and excited about the CBDR and my CBDR system. But I know very little about it. In fact, I know nothing. Jean Saint-Louis and Claude Meyer were about to make the presentation when they told David Page that they will not be able to make it. And since I strongly believe in this program, I decided to come up and take the risk of looking like a fool. So, this being said, I will move on. This is the brief outline of my presentation, our presentation. We are going to present this. I don't know how to handle this. There will be also a quick look back at our process for implementation, where we stand now, and suggested improvement into the new version. Well, most of you know that before November 9th, 2014, there had been several months of discussions between several of the stakeholders, and namely the Canadian Hemophilia Society, Association of the Hemophilia Clinic Directors of Canada, and also the payers for the system. So, but to come up with a simple summary of this evolution by November 2014, it had been decided that we would be going with the system that was that had been introduced in Australia, and that was called CBDR, with the clinical application called My CBDR. Now, happens to be that in Quebec, we were relatively better prepared, I believe, than most people in the field. In that bit of history here, back in 1979, the Ministry of Health in Quebec decided to designate to the exclusion of anyone else, for hemophilia treatment centers that were located with the 4 medical schools in Quebec. And the point that was clear at that point was that this designation was to take care of all bleeding disorders of all ages, as I used to say, from womb to tomb. Now, the special thing about the Quebec system was that it was clearly stated that this will be at the exclusion of anyone. In other words, if you want to receive factor concentrates, you had to get your prescription from the designated hemophilia treatment center. A bit military approach, but seems to have, initially was somewhat difficult to be accepted by many parties, including hemophilia people and hemophilia treaters. But with time, I think most people realized that was probably a good thing. Well, anyway, just as an introduction to see why it was probably easier than any other province or any other center to introduce this system. So once this was decided, contacts were made with the Ministry of Health, and there we were very lucky to have a very strong supporter, the deputy minister, who happened to be responsible for management of blood products in Quebec, supervising EMA Quebec. His name is Yves Jalbert, and this man had also been involved years before into the introduction of a system that we have in Quebec that is called Traceline. And Traceline is a system that is been implemented in every hospital, 90 of them of Quebec, with a blood bank. And this Traceline system makes into a network every hospital that has a blood bank, where, of course, blood products are being distributed. Now, one thing, in this system, Traceline, every blood or every concentrate that is signed out to a patient is considered to be administered. So there is this is a one-way system, and of course the previous system that we had, Charms, was somewhat the other arm of it, which had to be linked manually between Charms and Traceline system. Now, of course, coming with CBDR and my CBDR, for the time being, this linkage is not made, but I hope that eventually it will be made. So anyway, just to say that the Ministry of Health was very receptive and quickly, in fact, the deputy minister in this field took appointment with our administration, the director of the professional services, and to make a long story short, contributed to quickly put together a group of people who will be responsible for implementing this system. Of course, not only in Hôpital Sainte-Justine, but within the 4 hemophilia treatment centers in Quebec. Maybe good to remind the people that before we were using Elitrax, and of course we were also very, I'd say, enthusiastic, quote unquote, user of Elitrax. Not necessarily Elitrax itself, but the concept of having computerized data management or blood product management. From that group put together by or with the Ministry of Health at Hôpital Sainte-Justine, some more practical development took place, namely production of information kits, including video, And in June 2015, the first patient were enrolled at Untitled Sainte-Justine. And progressively, in the other 3 hemophilia treatment centers, after a training session that had been organized by our group for people responsible for the other hemophilia treatment center. Well, of course, we had to translate this in French, but that was not a terrible thing. One thing that comment that can be made in passing here is that with the introduction of this system, I believe that somehow we started to move towards a more uniform approach with data collection and most probably eventually or progressively a more uniform approach with the distribution of products. Again, I have a few more. 5 minutes? Okay. So, of course, here the contribution of staff nurses was extremely useful in the development of the clinical use of this system. Again, project manager and is an important person that will coordinate the introduction of such a system. I have to say also in passing, and I don't have this on the slide, but we have to say that we had an absolutely wonderful contribution and collaboration from Arun. Was always there to help, and I think here he deserves to be highly thankful for this wonderful contribution. Where are we now? We have deployed the MyCBDR in 4 hemophilia treatment centers. There were some disparity between centers, and most of the difficulties, I understand, had to do with the lawyer in each hospital. It's different ways of handling this, but I believe that this is solved now, and the 4 centers are working on utilization of this system. Well, I believe that the health professionals are very satisfied and happy with this system. My perception is that the users are very satisfied, and of course we will have a testimony from a end user of the system who will tell us what he thinks about this system. Well, I understand, and again, I started by saying that I'm not sure that I know what I'm talking about, but I understand that there is a little issue with the entry of data for blood units or concentrates that are used in hospitalized patients for surgery. But I understand that this is something that Arun is aware of this, and there should be a solution for this. Well, one wish that we have was that eventually, if we could have included in this system a pharmacokinetic calculator that will not be, if this is possible, specific product dedicated. Of course, I'm aware that there are such a pharmacokinetic calculator, but they are built specifically for a given product. So possibly it would be interesting to have such a addition to this system. I think that I will probably close. Yeah, I think I will let the real expert talk about it, and I will let Vanessa introduce our next speaker. Thank you.